So, what if managing a serious lung condition could be as simple as popping down to your local pharmacy? Well, today we're going to dive into a new program from Queensland Health that's trying to do just that, making some really vital respiratory care way more accessible for everyone.
But first, let me ask you something. Do you ever find yourself getting winded just from walking up a flight of stairs? Or maybe you're dealing with one of those nagging coughs that just won't go away. Things like that can seem pretty common, but sometimes they're the very first hints of something a bit more serious going on.
And that brings us right to our main topic today, chronic obstructive pulmonary disease. You've probably heard it called COPD for short.
All right, so what is COPD exactly? Well, you can think of it as a progressive disease that over time just makes it harder and harder to breathe. It's usually caused by long-term exposure to things that irritate the lungs, like tobacco smoke, air pollution, or even certain kinds of dust you might encounter at work. But here's the most important thing to remember. While you can't totally reverse the damage, COPD is absolutely preventable and for sure treatable. Now, since there's no magic cure for COPD, the whole game is about managing it effectively. It's kind of like playing defense, and these are the goals. You want to relieve and control your symptoms, you want to prevent those sudden flare-ups, and you want to improve your ability to stay active. The big picture? Just improve your overall quality of life and slow the disease down. And that's exactly where this new initiative comes into the picture. It's all about bringing that care a whole lot closer to home. Let's dig into what this new pharmacy program is all about. So this isn't just some random idea. This is an official Queensland Health initiative. It's been specifically designed to help people who are dealing with mild COPD. And because it has that official backing, you know it's a credible, properly structured plan that you can rely on.
When you boil it all down, the program has a pretty simple mission. It's about finding people with mild COPD early on and giving them the tools to manage it well, right from the convenience of their local pharmacy. It's all about catching it early and making healthcare just that little bit easier to access.
But is this program for everybody? That's a great question. Let's break down exactly who's a good fit and who isn't. So your local pharmacist might suggest a screening if you tick a few of these boxes. Think about it. Are you 35 or older? Are you a current smoker, or have you smoked in the past? Maybe your job exposes you to dust or fumes, or are you dealing with symptoms like a constant cough, getting out of breath easily, or getting chest infections all the time? Any of those could be a good reason to get checked out. This chart makes it super clear. On one side, you can see who this program is perfect for. We're talking about people with a diagnosis of mild COPD, or folks over 40 who've been identified through screening and whose condition has been pretty stable. But then, on the other side, it's not designed for people with moderate or severe COPD, or those with complex heart issues or frequent flare-ups. Those situations really need more specialized medical care. Okay, so let's say you are eligible and you decide to enroll. What happens next? Well, this is the part where you get to really take control of your health by creating a personal action plan. The whole assessment process is actually really straightforward. First up, you'll just have a chat with a pharmacist about your medical history, your lifestyle, your symptoms. Then, you'll do a simple questionnaire, something called the CAT, to get a picture of how the condition is impacting your daily life. After that comes a really important breathing test called spirometry to measure how well your lungs are working. And finally, using all that info, you and your pharmacist will sit down and build out your personalized management plan together. So this action plan of yours is really built on two main pillars. On one hand, you've got practical lifestyle changes, and on the other, you have the medication side of things, if that's what you need. Let's take a quick look at both.
First, let's talk about lifestyle, because honestly, this is the foundation. Your pharmacist can give you support to quit smoking, and that is the single most important thing you can do. They can also give you advice on physical activity, nutrition, and making sure all your vaccinations are up to date. They can even refer you to specialized programs like pulmonary rehab if that's a good fit.
Okay, now for the medication. It's a really smart, step-by-step approach that's tailored just for you. You might start with what's called a short-acting inhaler, which gives you quick relief right when you feel breathless. If your symptoms are happening more often, you might move up to a long-acting inhaler for daily control. And if things still persist, the next step could be a combination of long-acting inhalers. See? It's all about finding the right level of support that works for you. But here's the thing. Creating the plan is really just the first step. This program is also about giving you consistent, long-term support to make sure you stay on track. It's not a one-and-done deal. The review schedule is super simple and consistent. About 3 months after you start, you'll have an initial review just to see how things are going. Once your condition is stable, you'll have a check-in every 6 months. And this is really crucial. If you ever have a flare-up, you can get an urgent review right away to get your plan adjusted. You know, this quote from the official clinical protocol, it really sums up the whole idea perfectly. It basically means that your pharmacist isn't working on their own. They're a really key player on a much bigger healthcare team, working right alongside your doctor and other specialists to make sure you get the best care possible. It's all connected. When you step back and look at the big picture, a program like this really points to a bigger shift in how we think about healthcare. By moving this kind of specialized care into a place that's as familiar and accessible as the local pharmacy, it brings up a really fascinating question. Is your local chemist becoming the new front door to our entire healthcare system? It really makes you think, doesn't it?